This segment of Delmarva Life is brought to you by Delmarva Dental Services.
Well, when you think of Botox, the first thing that probably comes to mind is the ability to reduce fine lines and wrinkles.
As a matter of fact, we showed you yesterday what can be done to the face and to help treat certain conditions such as excessive sweating and migraines. But did you know Botox also has dental benefits? Ryan Spiros went to Delmarva Dental Services in Salisbury to show us how it can be used.
Botox is probably the last thing you'd expect to find in a dentist office, but truth be told, it has many benefits. Dr. Robert Esham and Dr. Joseph Harmon are dentists with Delmarva Dental Services in Salisbury. They say Botox has been used in dentistry for the last several years, but Delmarva Dental Services has been using it for about a year and a half.
And every day we give, 20, 30 needles, okay, to patients, so we're really good at giving shots. A Botox injection, though, however, is a very, very shallow injection. You barely go into the tissue or in through the skin far at all.
So how can Botox be beneficial when used in the dentist office? Doctors Harmon and Esham say one of the big ways is helping patients who suffer from TMJ, which can cause a great deal of pain in your jaw and the muscles that control its movement.
Many patients who came in with a muscle spasm in their jaw joint, you really couldn't do anything for them immediately. You would say, okay, take anti-inflammatory medicine, you could give them a muscle relaxer, you could give them, tell them to do a soft diet, but all that took time.
And Dr. Esham adds 9 out of 10 people who have TMJ are experiencing muscle problems.
For various reasons, we get into spasms and the muscles themselves pull the disc out of its joint. So if you use Botox, a muscle relaxer, inject it in the appropriate area, it will relax this and help.
Speaking of relieving pain, Dr. Esham explains that Botox can also help people who clench their jaw or grind their teeth.
If an individual grinds their teeth or bruxes or breaks their teeth, that the use of Botox in various areas in the muscles of the face, that in turn that relaxes those muscles. They cannot clench or grind nearly as hard.
Botox also helps those who have what's called a gummy smile, where much of your gum is exposed.
What can be done with relaxing of muscles, basically the muscles of the upper lip, then in turn you just do an injection here and here, and the amount of that you inject would be determined by how much you want the upper lip to be lowered. You can still smile, you can still laugh, you can still function in that respect. So from that standpoint, it doesn't paralyze the lip. You still can do everything you normally do. It's just that you cannot raise it quite as high as you used to be able to.
So Dr. Esham, we're talking about the gummy smile, and here we have a patient who has just that. How were you able to help her?
We did crowns and so-called crown lengthening, and it was discussed before, but and then also the Botox was added at the end, and it gives a beautiful result.
And obviously, as people can see from her smile, because of the Botox and it relaxed the upper lip and lowered it, you can't see her gum anymore when she smiles.
That's correct.
Dr. Harmon says that typically Botox will last 3 to 4 months, and the more you use it to treat dental work, the less you need over time to see results.
What happens is the muscle actually gets smaller with time. So the amount of Botox you need gets less and less and less because the muscle atrophies, gets smaller and smaller. So it has a greater effect as you go.
Keep in mind, before any Botox is injected, all patients need to sit down for a consultation.
Delmarva Dental Services says one of the big questions people ask is, do the injections hurt? Well, Drs. Harmon and Esham say for most people, the pain's tolerable. However, they are able to use numbing cream or ice to help ease any pain, just in case a patient thinks they might need it.
I do that. Or
I do too.
Clench my jaw.
I do too, and then everything's fine after that. Well, from your health to your home, did you know certain things you have at your home may classify you as a high insurance risk? We're going to learn what they are and find out what you can do to make sure everyone stays safe.
And later, wouldn't it be nice to stop the stress? It may be as simple as stepping outside. We'll explain. Delmarva Life will be right back.